Yes, my name is Laura and I'm the dietitian at this facility. Yeah, so I've worked with Mateo a little bit, so I appreciate you two coming in so I can review my assessment with you both. Okay, yeah, so let's get started. All right, so as you might know, Mateo is considered to be anorexic. His condition, anorexia nervosa, is characterized by an energy restriction which leads to a below normal body weight. Yeah, so additionally, a disturbance in his appearance. Your son has expressed that preoccupation with his body shape, and he will engage in what is known as body checking. So with Mateo, we see that through his frequent measuring of his thighs and his waist. Yeah, so oftentimes somebody with anorexia might not really realize how severe their condition actually is. Yes, exactly. Yeah. I know Mateo has consistently insisted that, he has a normal body shape, so, he does fit that criteria. Yeah, so I do believe that really what triggered your son's condition was originally the teasing remarks he received about his weight from his peers. Yeah, at 14, he is at a very impressionable age, and on top of that, the loss and grief that he suffered from losing his sister really could have exacerbated the condition. I'm so sorry for your loss. Yeah, so this condition is most commonly seen in individuals who have perfectionist tendencies. So previous childhood traumas aren't a prerequisite to developing an eating disorder. Yeah, so due to the serious results of Mateo's percentiles for both BMI and age on the growth charts, it's really important that we take a more aggressive approach to getting Mateo nutrients. I understand he's currently receiving the multivitamins. However, I will agree with the doctor's wishes to introduce the nasogastric or NG tube. Yeah, so this isn't a long-term intervention, but it is necessary to initiate this procedure to at least get Mateo stabilized and prevent any further complications from potentially arising. Yeah, so once he starts to gain some of the necessary weight back, we will start to wean him off of the tube feed and reintroduce the solid foods. Yeah, so at this point, his lab work is a little bit concerning. Being able to analyze these results can help us to establish when he's starting to make some improvements in his condition. Yeah, so one of the first things, the hypercholesterolemia, or the elevated cholesterol levels, pretty common with this diagnosis. So if you remember, Mateo's cholesterol levels were elevated, which we will work on bringing down. Yeah, so currently he is displaying some signs of anemia, so we'll monitor this condition to see when symptoms subside. Yes, we're also going to need to be cautious of Mateo's cardiovascular or his heart health, because his ECG showed that he has bradycardia, which is a slowed heart rate. So a little bit slower than normal and a little slower than where we want it to be ideally. Yeah, no, it's not uncommon with this condition. So, with proper intervention, this can be reversible, but it's just going to take a little bit of time. Yeah, so because of his restriction of food, he will need to work within a team setting to help ease his anxieties regarding to his intake, to alleviate some of the causes, the root causes for, his anorexia, and minimalizing the chances of